you were saying that people, if they can't get access to insurance, they don't have coverage. But
Right.
if you remove the individual mandate, you are going to have people who are not going to buy coverage. They're not going to buy insurance. And so, getting back to the Congressional Budget Office score, would you concede that there will be some coverage losses, perhaps in the millions? That there will be millions of people who will not have health insurance as a result of what you're doing?
Well, again, sure, except you have to look at the current situation. You are mandated by law to buy insurance right now under Obamacare. 13 plus million people have asked for a hardship exemption, and then 6.5 plus million people have determined to pay the penalty. So currently, if we look at the universe and say it's roughly 30 million people, only 9 million people engaged in the exchanges when required by law. The majority, almost 2/3, if my back of the envelope math is right, about 2/3 have chosen to either apply for a hardship exemption or pay a penalty. So
the mandate forces people to buy insurance, and if they don't have insurance, then you have the free rider problem in the system.
Right, but look at what's happening now.
So you have free riders, and those folks
no, because the current
they show up at the emergency room, and then the health care is much more expensive.
But they do it right now. But my point, Jim, is that the way the system was constructed under Obamacare, they created the system to force people to buy plans that they did not like, that were mandated by the government in terms of what was part of the plan, what it had to cover, the deductible, et cetera, et cetera. And yet, roughly 2/3 of the people either paid a penalty or asked for a hardship exemption. They didn't do it. And so the idea is, actually, if you could bring down cost and choices and allow people to find a plan that fit their budget, that was tailored to their needs, there's actually a higher likelihood that they will find something that they want at a price that they can afford, as to right now, which is, I get a plan that I'm forced to buy that has a deductible that I can't afford, but I've got a cute little plastic card that I can wave around.
This will get you coverage.
No, that's not true.
If you show up at the emergency room, if you've been hit by a bus,
sure,
you're not going to be just paying out of pocket to the hospital.
But under any scenario,
you're going to have some sort of catastrophic coverage that will make sure you have insurance.
Thank you.
That's
that's a great advertisement for thank you.
But
that's exactly what the president's trying to do, because right now you've got of the attempt to get 30 million people covered, 14.5 million people applied for a hardship exam. They're exactly the people that you're talking about. Another 6.5 million people have paid the penalty and don't have it. So we have roughly 20 million people in this country who were supposed to be required to buy health care, that have chosen not to do it, who fall in exactly to the category that you're talking about. The question...
But that's
no.
That number is massive by the year 2026.
Right, and so the point that I'm...
20
hold
million
on.
Americans.
But if they actually had choices and had a plan option that was down at a budget they could afford, there is a higher likelihood that they would buy a plan that was A, tailored to them, and B, actually that they could afford. So to your question about catastrophic, right now that's in most cases not even an option. In a third of all the counties in the United States, they only have one choice. In 5 states, they have one choice. Can you imagine if they could actually buy a plan?
That talking point, but at least
not a
there is
talking
coverage
point.
in those states.
No, it means
option of coverage.
Right, and in a lot of
if you pull this away, then you're going to have people in a lot of states who aren't going to have access to any
that's
coverage.
not totally
because
false.
they can't afford it with these tax credits you're providing. There's an argument to the other side.
No, there's not. No, actually,
the subsidies
I don't.
are more
You've got
generous
175 million Americans that get their insurance through their employer, and frankly, right now, they're the ones who keep paying higher and higher premiums because a system that was only supposed to help people get access and require them get a government mandated, government run health care has actually gone amok. And so right now,
government-run healthcare, Medicare is government-run.
Right, and what's happening?
Senior citizens
and more
screaming that they want you to get rid of their Medicare.
I think you need to maybe get outside and talk to some of them, because more and more Medicaid recipients, in fact, more and more Medicare recipients, aren't actually able to get coverage. Again, it's one thing to have a card. It's another thing to walk into a doctor's office and them to tell you, we no longer accept Medicaid anymore. That's not care.
But the president's okay with
there are
going to be millions of people who aren't going to have coverage.
The president's goal is to provide health care coverage to every American. And right now, they're not getting that. And by giving them more choices at a lower cost, more Americans can either buy health care for their family or themselves, or in a lot of cases for their business, without paying the penalty, which is what a lot of them are doing, or forcing people into exchanges that have fewer and fewer choices. The system now is not working. The costs are going up, the choices are going down, and deductibles are going up. That is not an option. And for every American, and I mentioned this earlier, that to make this look like a choice, there isn't really a choice. The system that we have now is failing. The choice is whether we give them an opportunity to have real care, and in a way that is tailored to them in their budget. Jeff.
The manager's amendment
Yeah.
is a tacit admission that the bill as written can't pass. You wouldn't
No,
put
that's
together
not
a
entirely
manager's
true.
amendment if you had the votes, correct?
Well, no, I think it's a admission of what we stated at the beginning of this entire process, which is the president was going to engage with members to hear their ideas. He welcomed them. Director Mulvaney stated it multiple times, and Secretary Price, the vice president. We're not. This has never been a take it or leave it, and I've said it from this podium. The president's talked about it, as you mentioned just a second ago. This is an opportunity to hear from individuals in groups and insurance and victims of Obamacare and doctors. Hold on.
More Freedom Caucus support.
It's not a
by
question of just.
dealing
It's
with
not. It's not
Medicaid
about.
or the tax credits or some other alterations.
It's not about one caucus or one member. I think this is about bringing people together, and if we have great ideas that will achieve a better outcome for the American people, then we're going to listen to them and we're going to incorporate them. I don't think that this is. We have been very clear from the get-go. If you can come with a good idea that will strengthen this bill, that will benefit American patients, we'll do it. And so the manager amendment is
about getting votes, right? You can't have a strong bill that can't
no.
pass.
You
right?
can jam absolutely, but you can jam through a bill and get it out, get 218, and send it over to the Senate. But I think that we want to get the strongest bill through the House with as many ideas and opinions and facts that will help strengthen this as possible. So I'd rather, instead of getting a bill through with 218, 219, work on a process, as the Speaker and the Majority Leader have done, that brings in additional ideas, and if we can get the bill higher and higher, we will.
To Tom Cotton's point, because you talked about it just a second ago, prongs 2 and 3.
Yeah.
He went out of his way to describe that process 2 and 3, because at least the third part of that's going to require 60 votes, because
Yeah.
it's outside of reconciliation, by definition, as mythical, imaginary, and just spin.
Hi, this is Sharon reporting from Bad News Media. Thanks for subscribing to our channel and giving us a thumbs up. We really appreciate your support. Please feel free to leave us a comment and share this video with your friends. Thank you.